Come back. Let's continue our discussion on today's issue on ENCA. Still joining us via Skype is the Health Department's Deputy Director General, Dr. Anban Pillay, the President of Business Unity South Africa, Mr. Sipho Pityana, the South African Medical Research Council President, Dr. Glenda Gray, and social analyst, Ms. Tessa Dooms. Mr. Pityana, can I start with you in this segment? The President, when he announced the move to level 2 of lockdown, said it's going to be accompanied by discussions with business, labour and civil society about an urgent economic recovery. You said just before the break that the primary concern for everybody, including business, is saving lives. How are you going to, you think, you're going to achieve that urgent economic recovery? What should the role of business be to achieve that while saving lives?
Well, then let me say this again, that we start from a premise that no business is sustainable where the workforce is either unsafe or faces a health challenge. So one of the most important ingredients to any successful enterprise is taking good care of your employees and making sure that they are healthy and all of that. So that's a very fundamental approach that we have been...
Is that a united view? Is business united in that view?
Business has a common perspective in that view, but of course, as the shoe pinches on reopening, you begin to see impatience with in some sectors that this is not sustainable. We have to open, and of course that raises the narrative that we have to come to terms with the fact that we're going to live with this virus for the next period of time, and therefore lockdown is not a sustainable approach on a going forward basis. What does that mean? It does place a great deal of pressure on both employees and employers to ensure that we work together to sustain the gains that we've made so far in ensuring that our workplaces are safe from further spread of the virus and infections. So that health response has to be sustained right through as we open. The burden is greater on businesses in an environment of a reduced lockdown regime, because we now have to put more resources and more efforts in ensuring that that doesn't spread. Because remember that even as we open and we've seen this in those sectors that were allowed to open in the earlier lockdown arrangements, that the spread was very fast and we had to respond very quickly, and the measures that were introduced by some of the sectors proved to be inadequate. We're going to experience something similar, I would suspect, with regard to others that are now being opened up. So it's very important that we don't underestimate the health challenge still that is going to come with the reopening of the economy. The reopening of the economy has to happen because we have to deal with the issue of livelihoods. So it's not lives and then livelihoods. It's a combination of both. So we have to manage that twin track in a sustainable way. In a sustainable way,
but it's a very tough balance. It's a very tough act. How would you respond to that, Tessa? Livelihoods, lives, and economic activity is necessary because even saving lives sometimes would border on people being economically active.
Yes, I think that there's two parts to that. There's an economic part to that, and there's a health strategy part. I think first on the economic front, the idea that we need to change the structure of our economy has never been more important than now. The idea that we need to minimize people's movement, so creating economic activity closer to where people live. So we talk about township and rural development and township and rural economies. Now more than ever, we need people to be able to trade closer to home where they're interacting with fewer people and where they're not having to travel to major economic centers in order to do so. We also need businesses to not only hold themselves accountable, but also to be held accountable by the state if they're not implementing the right kind of precautions, but also if they're placing the burden of the economic losses and the health regulations onto employees. We've seen employees lose their jobs because they become COVID-19 positive or be threatened with their jobs if they disclose their COVID-19 status to other people in their companies. We can't have that continue if we want businesses to open further. But on the other side of that, businesses also need support from the health department and from the medical response in terms of testing, tracking and tracing and quarantine. It helps so much, and we've seen it all over the world, that if you have sufficient capacity to test everybody who needs a test, things become much better. And there's growing concern that since the beginning of June, that we've had almost a rationing of testing, and the criteria for testing has become stricter, and that we're focusing on testing older people, people with comorbidities, and those who are hospitalized. And as Dr. Gray said earlier, there are many people who have mild symptoms who are asymptomatic. And unless we are able to track and trace those people, test those people, quarantine those people, it does raise questions about even the stats that we have now. Does it show us the full picture? But more importantly, does it help us get people back into the economy safely, or make sure that we manage their activity in the economy through these measures?
Dr. Pillay, let me bring you in here then on that point, or those points that Tessa is raising. Should we be testing more? Should we change our health strategy? And do you believe that the department is well placed currently to provide the necessary support to business as most economic activity, with that risk that is still there that we could face a second wave?
Yeah, I think certainly we can improve our testing. The challenge has been the supply of the test kits historically, and that has caused ebbs and flows in the number of tests that are available, both in the public and the private health system. We've been able to remedy most of that, and currently the National Health Laboratory Services, as well as our private laboratories, have many more test kits than what they had previously. So the rationing, I think, that Tessa's talking about has been something that we had in the past in order to manage who would be priority for testing.
So are you going to test more people now? Are you going to test more people now with the availability of the kits, as you say?
Yeah. Yes, certainly. So I think some people may still believe that there's a shortage, but actually the labs, both public and private, have sufficient test kits now. So we can certainly increase the number of tests, and we can do way more tests than what we actually currently do.
Should you provide those test kits more and more to business as economic activity is opening up? I mean, Mr. Pityana earlier was saying that in the earlier stages of lockdowns, where some economic activity was happening, we saw an increase in infections.
Yes, so I think a number of businesses have actually taken it upon themselves to arrange with private laboratories for testing to happen in their environments. But their difficulty was that they didn't have kits. So while they wanted to do testing and they had the resources to support that, the kits were just not available because globally everybody was demanding these kits. We're seeing a decline globally in the number of cases, and so many countries that have been testing quite widely have reduced their testing, and that's allowing us to get more kits. And so I think we can certainly support business in them doing more testing, because the workplace is an environment where there can be transmission quite easily, and we must certainly support business to prevent that from happening.
Are you going to change your strategy overall? I'm asking this on the back of two things in mind, which I was going to bring up. Tessa sort of alluded to one of them earlier by saying, are these numbers that we're seeing really the true numbers? Just the other week, we had reports from researchers saying our death toll from COVID-19 could actually be 20,000 higher than it is.
So I think on the number of cases, certainly those that come through for testing are the ones that we identify. We know that there are many more people out there in the community who may be asymptomatic, not seeking tests. And so we would not know the full status in terms of totally how many South Africans actually are infected at any point in time, only those that we've tested. Every country has a similar problem. And it's very difficult for anyone to test everybody every day, for example, to get a sense of the extent to which you have infection on a daily basis. So I think we're trying to encourage those that are at highest risk to be tested, because the adverse events happen to those that are in the highest risk groups, the elderly, those with comorbidities, etc. On the issue about deaths, I think there are deaths that happen at home, and those deaths are not captured simply because the person that completed the death certificate may not necessarily report that death as a COVID death, because he or she may not be aware that the person was COVID positive for the reasons I mentioned before. And so we're trying to deal with some of those challenges by suggesting that at the point at which there's a death at home, the medical officer can do a test of that individual so that we can get a better sense about how many people. But more importantly, I think, is we need to encourage people to come to our facilities when they have the slightest symptoms. It may not be the usual symptoms, but COVID is something that appears to very quickly progress to an adverse stage and requiring ICU and mortality then happens very quickly. So I think it's important with the earliest symptoms to seek care rather than waiting for it.
So as part of the strategy going forward, you would be encouraging the public to really take advantage of being tested because you've got the test kits. Dr. Gray, from a scientific basis, what else, very briefly, besides testing, do you think government should do in terms of the strategy going forward? Everything is now open. I mean, many people are pretty much thinking we're back to normal.
The only thing we can do is continue to implement our non-pharmaceutical interventions. The tools we've got are over 100 years old, but they're the most important. It's wear a mask, wash your hands, keep the social distance, make sure you're in well-ventilated areas. And that's the only tools, unfortunately, that the government has and that the world has until we find an effective vaccine. We know what works. This intervention has helped us avert the flu epidemic. By wearing masks, washing hands, and keep maintaining our distance, we managed to avert the flu epidemic in South Africa.
Okay, thank you very much, Dr. Gray. I've got Dr. Pillay with me as well. I've got social analyst Tessa Dooms and BUSA, that's Business Unity South Africa President Sipho Pityana. We'll carry on. In the next segment, I really want to take a look ahead. How likely is a second wave in our country now that most economic activities is back on? And if so, what each stakeholder should do in order to assist to make sure that we do not really see the worst still to come? Stay with us.